this is new. Something new is happening. He's also seeing it in 40 to 45-year-olds. And this has been described as a non-infectious pandemic of cancers. So we've had a pandemic of an infectious disease. Now we seem to be getting a pandemic of non-infectious disease. Cancer is usually a non-infectious disease. Colleagues of Dr. Sung Song have seen colon cancer, and again, colon cancer, again, associated with older age groups. Now, we do get colon cancer sometimes as a result of genetic abnormality in people in their 30s, 40s, even 20s, tragically. It does happen. But typically that's due to some specific genetic abnormality. Colleagues of Dr. Sung Song are seeing cancers in 8, 10 and 11-year-olds. Again, this is just unheard of. 8, 10 and 11-year-old children developing colon cancer. They're seeing a lot of women in their 30s and 40s with ovarian cancers.
And now, very importantly, and this goes to that question of all these anecdotes that we're hearing from different oncologists around the country and the world, literally. I got a very interesting note from a family doc that's been in Ireland for 40 years. He knows his community, knows his patients. And he said, hey, you know, a lot of my patients are getting the shot, some aren't. But in those that are, and then he listed the number of cancers he's seen in a 6-week period of time that he's never seen in a 40-year career. Wow. And so he asked what could be causing that. So I sent him that paper as a potential mechanism because that toll-like receptor number 4 is critical in the microenvironment to keep cancers in check. So I was talking to Harvey Risch, the world-renowned epidemiologist. He said, well, you know, post a shot or a therapy, it's usually going to be 5-10 years till we see these signals. And I said, yeah, usually it would be. But when we have something we've never done before that's suddenly suppressing one of these receptors that's highly, highly responsible for keeping cancers in check, it would be very explicable as to why something that is quiescent all of a sudden wakes up. So, I mean, all day long, our cells are fighting off mutations in different cells. If they see the mutation, they'll try to kill that cell. If this receptor is downregulated, then all those downstream molecules inside that cell that's fighting there, it can't fight because those signals are now turned off. The cytokines, the interferons, the things that will attack that atypical cell. So we're seeing the early signals of this. And so that's what's concerning is we want to be able to, you know, under the microscope, you know, here's a whole stack of tumors in the last couple of weeks where what am I doing with these? I'm looking at the ratios of the helper T cells, the CD8 killer T cells, and then we'll be staining these for all of these toll-like receptors as well. Because in some of these patients, again, inexplicable cancers at really unusual ages that are really thick cancers and really aggressive cancers compared to what we are used to seeing in the lab.
What I've seen way too much of, and it does cause me very serious concern, is we're seeing people who had cancers that were in remission or that were being well controlled, and their cancers have gone completely out of control after getting the vaccine. And what we do know with the vaccine causes at least a temporary drop in T cell numbers, and those T cells are part of our immune system, and they're the critical weapons that our immune system has to fight off cancerous cells. So there's a potential mechanism there, and all I can say is I've had people contact me with way too many of these reports for me to feel comfortable. I do feel that's probably, I would say, my newest major safety concern, and it's also the one that is going to be by far the most underreported in any adverse event database, because if somebody's had a cancer before the vaccine, there's no way public health officials will ever link it to the vaccine. But what we're seeing is oncology teams that had pushed the cancers into remission or were keeping them well controlled can no longer control them after the vaccine.
I'm Morgan Wallace. I'm a 10-year employee of New Hanover County. I worked in the cardiovascular ICU for 5 years. I was your last line of defense with COVID. We ran your heart and lungs outside your body with your chest open while you were bleeding on the floor. And what I realized was that patients were needlessly dying because of government's withheld policies for treating COVID. Everyone who died with COVID should be considered murdered, Early treatment has always been effective. I walked out of the hospital on the mandate day. I have my own practice, and I am the only person in town treating COVID patients prior to hospitalization. I also watched the entire staff at the hospital, including in my unit, get vaccinated and then get COVID, amongst all kinds of other ailments. You have now loaded your body with millions of spike proteins, and you are a ticking time bomb for cancer, blood clots, and whatever kind of ailment may come up in your body. And I'm tired of hearing people go and ask doctors, can they be treated for COVID, and their only option is a vaccine or go home or go into the hospital where you're not going to make it out. I will be happy to treat any one of you for COVID prior to going to the hospital, because early treatment has always worked. I'm a member of the FLCCC Alliance, NC Physicians for Freedom, and the Medical Freedom Summit. And I would ask y'all to please stop choosing fear and putting masks on our kids. The vaccine is not going to work. Early treatment has always worked, and government mismanagement of patients is why people have died. And families have realized this, and they are rising up, and they are going to come after governments and the hospital. I was highly decorated and highly respected at New Hanover. I was the November 2020 Employee of Excellence, and I had a job opportunity this year from the chief medical director at this hospital, and I chose to walk out and stand up for what is right. So putting these masks on our kids is not going to help, nor is vaccination, and we all need to realize that. It is out, the cat is out of the bag, and people are speaking globally, including the inventor of the vaccine.
There's literally thousands of AP, Reuters, even New York Times are like, hey, if you take the Moderna or Pfizer, you're going to think you have cancer in the lymph nodes and in your uterus, but it's no big deal. And in your breasts and other areas, it's no big deal. Doctors, if it looks like cancer, just don't treat it for 6 months. Well, then, Roger Stone's wife got the Pfizer. Within a month, a huge tumor grew under her arm, stage 4, lymphoma, non-Hodgkin's. And so you were warning of this 1.5 years ago. Here it is. And now I've talked to the oncology wards, and others, they just say they're full of exploding cancers of the people that took it. So Fauci knew this is super bold. Explain what this so-called shot is doing and why I've seen the my studies at UT he funded in 2012 where it caused not just blood clots but cancers. And the scientist said, don't use this as a human vaccine. He then runs out and gets it and uses it. I'm no top scientist that worked with him like you, but, this is just totally premeditated.
Correct, because I led the lab of antiviral drug mechanisms in 1999 through 2001. And before going to Direct Epigenics Pharmaceuticals Cancer Biology Program, where we knew these mechanisms right then and there. You express the envelope, the spike protein of a murine leukemia virus-related virus, XMRV, or our own gamma retrovirus known as HERV-W, human endogenous retrovirus W. You're injecting the envelope protein. The envelope protein alone that our colleagues, the Rossettis, have known, and their research back at the National Cancer Institute my days there started June 10th, 1980. So for 20 years, we knew expression of syncytin, the envelope protein alone, cause cancer. That is in the spike protein of these vaccines. You are injecting the blueprint to drive cancer.